We now go to our reporter Laura Windsor with a story about the importance of breastfeeding.
Human breast milk is nature's perfect food for babies. Breastfeeding promotes the health of both mother and her baby and helps to prevent disease. We went to Loma University Children's Hospital and spoke to Dr. Raylene Phillips, who specializes in neonatology. She tells us why breastfeeding is so important for newborns.
Because all mammals' milk is species specific. So the milk for cows is made for baby cows, and the milk for whales is made for baby whales. And human milk is made specifically for human babies. So it's much easier to digest, and the nutrients are perfectly suited for optimal growth and development. Now, babies who don't get breast milk have higher risks of infection. They have almost double the rate of respiratory infections and ear infections. They have higher rates of diarrhea. They have higher rates of obesity. They have higher rates of asthma and allergies. And even more serious things, they have higher rates of childhood leukemia and type 1 diabetes, Crohn's disease. Actually, a double the risk of sudden infant death syndrome if they're not breastfed. Breastfeeding is also important for mothers because when mothers breastfeed, they release a hormone called oxytocin, which helps to contract their uterus and decrease the rates of postpartum hemorrhage. Breastfeeding also uses calories and helps mothers to return to their pre-pregnancy weight sooner. But more importantly, it helps to reduce the risk of mothers getting breast cancer, ovarian cancer, and uterine cancer later in life, and also reduces their risk of osteoporosis. One of the most important ways to get breastfeeding off to a good start is by starting immediately after birth, by keeping babies and mothers together in uninterrupted skin-to-skin contact immediately after birth. Now, we call this first hour after birth the sacred hour at our hospital. And the reason why we call it the sacred hour is because it's such a special time. There's so much going on when baby is meeting mother and father for the very first time, and the baby is transitioning from intrauterine to extrauterine life, learning to breathe air for the first time. We know that when babies are skin to skin with mother, that's the place where they are the warmest, where they are the safest, where they are most physiologically stable, and where they can get their most optimal nutrition. When babies are skin to skin, they can find their own way to the breast. The recommendation by all organizations that are interested in the health and well-being of babies is that babies receive exclusive breast milk in the first 6 months of their life. That's the perfect food for babies. They need nothing else. And then after 6 months, they should start some solid foods, but they should continue to breastfeed for at least 1 to 2 years.
Dr. Phillips talks about some of the challenges moms face when it comes to breastfeeding.
Only 16% of mothers are able to continue exclusively breastfeeding for 6 months, even though 77% and sometimes more want to breastfeed. One of the challenges is there's not a lot of consistent prenatal education on breastfeeding, why it's important, how to do it, how long to do it. Once the baby's born, babies are often routinely separated from their mothers. And even for a few minutes to a few hours is detrimental to getting breastfeeding off to a good start. Mothers don't often get the breastfeeding support in the hospital that they need or when they go home. It can be very challenging in the first couple of weeks of breastfeeding, and mothers often need help to encourage them and support them.
Dr. Phillips gives her best advice for moms and breastfeeding.
First of all, the baby needs to be skin to skin with mother so that we can take advantage of the instinctive behaviors that nature provides. Secondly, often mother might need some help from from someone who has specialized training in breastfeeding support, because babies need to latch correctly in order to be able to transfer milk and not cause mother pain. And that can be done with a good latch. It's most easily done, again, if the baby is skin to skin and instinct guides those behaviors.
Uninterrupted skin-to-skin contact with mother immediately after the birth provides everything a newborn needs: warmth, protection, nutrition, and love. For the American Health Journal, I'm Laura Windsor.